Let me tell you about the general concern or the general position of Ghana as far as COVID-19 is concerned. This morning, the Ghana Health Service said it has made giant strides in its efforts geared at combating the fast-spreading COVID-19, as it expects 66 of the nation's 566 cases to fully recover. Now, that will be great news. 17 others were told to have already fully recovered, and they say that they've done they've tested negative twice after their treatment. Now, additional testing centers, the health service says, have been set up across the country. The Ghana Police Service, in the meantime, is also saying that it has made some arrests. 406 persons thwarting government's efforts towards containing the virus. Those are the people who have been arrested. Now, top officials of the Ghana COVID-19 response team have today been addressing a host of issues at the usual, or what has become our new normal, news conferences frequently. There is more in this report by Joseph Akable, who was there for us.
Global recoveries from the fast-spreading COVID-19 have so far been slow, despite thousands getting infected daily. Ghana has for weeks recorded just 4 recoveries, with case count at 566. Director General of the Health Service, Dr. Patrick Abuaji, says 17 persons are fully recovered.
Currently, we have a definition of recovered as those who are positive and has recorded 2 consecutive negatives. And that's what becomes that you can claim that you are cured. Currently, we have 83 people in that category who have, a significant number have tested the first negative, but we have about 17 who have recorded double negative that are obviously clinically cured, and that's quite good. We also have about, out of this number, we have about 208 who are well asymptomatic or in a mild condition and being treated at home in isolation centers. Currently, we have only 2 critically ill people in the hospital with 10 deaths. So like I said, we have about 17 who have tested double negative, and so they are completely cured. We will monitor them, obviously. We have 66 of them who have tested the first negative, and we are waiting for the second test. The chances are that they will all be negative again.
He also revealed testing centers have been opened, bringing the number to 6.
Our current testing sites has been expanded in Oguchi, in Accra, KCCR in Kumasi. In the last few days, we have brought on the National Public Health Reference Laboratory in Kolebu. They are also doing so. The Veterinary Service Division in Accra and Pong Tamale have also joined in testing, and so CSR2 is testing. So we are slowly expanding our capacity to test, because that's extremely important, because the essence of treat, test, and manage is to identify and isolate all positives from the community to prevent further spread. And so the faster you get your results, the quicker you're able to move them out of the society.
The Ghana Police Service has been at the forefront of enforcing the restrictions imposed on movement and social gatherings. 406 people have so far been arrested. ACP Lydia Donko is head of prosecutions of the Accra region.
State here for emphasis that if you are arrested, you will be prosecuted after successful investigations, and you are found guilty, you are likely to pay a fine ranging from 12,000 Ghana cedis to 60,000 Ghana cedis, or to a term of imprisonment of 4 up to 10 years, or both. So it is in your own interest to comply with the rules and regulations, ensure that you are staying at home. If you are found on the road and the officers are compelling you to go back home, ensure that you do not engage in any resistance with the officers. If you do that, you are going to be arrested, and definitely you will spend time in our custody and you will not be free to go home.
The Communication Ministry has developed a mobile application to help citizens report cases. Minister Eslowusu Ekufu assured it will assist in the fight against COVID-19.
As at this morning, there have been 16,000 downloads already, even though it's just through the web link on Android. And the reports on it are interesting. About 100 of those have reported symptoms which are likely to be corona-related. So we'll pass on that information to the Ghana Health Service. So out of the 16,000 plus, we have 100 that are of interest that would make it easier for them to target and locate. And I'll encourage everyone to also utilize the app. And we're working with the Apple Store to make it available on Apple. But the information we got was that many of the smartphones in this country are Android-based. And so we figured that by making it available for Android users quickly, we would reach a larger population as quickly as possible, while we worked with the App Store to also make that available. It is Ghana specific. We're interested in what is happening in our country. I know there are others that are looking globally and collecting that information globally, but yedi yefie asem.
Minister Esla Wusu there, ending that report by Joseph Akable. Some of you are still sending your messages in as to how you're doing at home, learning at home. I'll read some of them before we do a break here. This one says, hello, I am Arthur, a pre-second, and the school has already got us a digital class platform. So he says it feels like I'm in school. We have tests, assignments, and courses. They are being recorded as well. Thank you, and we pray every school gets this opportunity. To pre-second, we are still in school, he says. So these are some of the ideas that schools, private school, for example, can learn from, so the people still have access to online platforms to study. I know that Akosomo International has a platform like that as well. This one says, Gift. In fact, I'm a teacher staying at home. Not meeting my colleague, teachers, and students is boring. I support Professor. The government should find ways and means to help our students, especially the BECE final year students. Thank you for sending in your messages, sir. This is Wisdom from Dakuma. This Wisdom says, I have been trying to read my slides, but it has never been easy. Wisdom, you have to psych yourself up, and you really have to be self-disciplined. Nobody can do this for you except you. This one says, Joy Learning is a very good program. I urge all students to take advantage of this, and it is coming from Fiam Nogo in Abo. Thank you for sending in that message. So go on your multi-TV digital TV and access the Joy Learning platform. This one says, I'm Paul, a nurse at Dominancy SDA Hospital, Bekwai District. Please kindly let government come to our aid for PPEs, since there's lack of PPEs to work with. You're talking about the SDA Hospital, Bekwai District. The government says if you have any of these concerns, do check with your district, the leaders at the district level or the district level authorities. Do that, and let's hear from you again. If you don't get any response, we can talk about it here and get the authorities to respond. Okay, so let me take this before we go and do Frontline. Anglo God Ashanti AGA School in Obuasi has introduced Google Classroom e-learning, which I think has been effective for our wars. From Papa Yao Obuasi. Papa Yao, thank you for sending that message. And it'll be interesting to find out really how Anglo God Ashanti is doing this and how other schools can replicate it and get it to work. Do keep your messages coming in. I'll take a very quick break. When I return, I read more of your messages, giving a lot of people ideas as to what to do whilst you're having to study at home. But remember, Joy Learning is an effective way to get it done.